You're listening to the Jōrni Podcast. Ever wondered how certain medications might impact the way your body moves? Tune in today to learn more. This episode contains adult subject matter, and some listeners may be triggered by this content. Listener discretion is advised. Hi, I'm Petra Brunbauer, and with decades of experience with sadness, pain, anxiety, and stress, I finally figured out how to leave all that behind. And this podcast shows you how to break free permanently so you can reclaim your sanity and find the self-esteem and energy to go after the life you desire. With real talk about mental health, holistic healing, and the tough journey of coming out the other end. This is the Jōrni Podcast. Welcome to today's episode. In this episode, we explore the little-known world of medication-induced movement disorders and how they can unexpectedly affect daily life. From the confusion of initial symptoms to the struggle of finding the right diagnosis, we take a closer look at what it means to navigate these complex challenges. Lenny Gallo is a writer, artist, and clinical social worker. His artwork has been featured in galleries worldwide. His essays and articles have been featured in professional journals and trade papers. In addition to his art and writing, Lenny graduated from Fordham with an MSW and works as a therapist specializing in the treatment of OCD, trauma, and anxiety disorders. His new book, Unstill: The Ordeal of Anxiety, Pills, and an Undiagnosed Disorder, a memoir, discusses the harrowing journey he went through to get answers, a diagnosis, and treatment for a condition he developed as a side effect of medications that he was prescribed. Let's meet Lenny Gallo. Hi, Lenny. It's so great to have you on the podcast today. I've been looking forward to getting to chat with you because movement and medication is quite a fascinating topic that we'll be talking about today. And I know that you have a very personal story to tell. So I very much look forward to diving into that. Welcome to the podcast.
Thank you so much for having me. I really appreciate the opportunity to be here.
Yeah, it's my absolute pleasure. I feel that so many personal stories, they need to come out and reach our listeners so that people can hear when they're in the same situations or similar situations on what they can do and how other people have worked with the challenges they have. So I am so privileged that you're here today. And let's tell our listeners a little bit about what we'll be talking about today. So do you want to share a bit about your story and how that connects into what you want to speak about today, and maybe a little bit about what you do today so our listeners can get an idea of who you are?
Sure. Well, I am a therapist here in the U.S. I'm also an artist and a writer. So I see a lot of people individually for all sorts of mental health issues, my biggest ones being OCD and anxiety disorders. Today, I kind of wanted to introduce your viewer, or your listeners, I should say, to this idea of medication-induced movement disorders. And I guess I should kind of probably tell a little bit about what that is. If you think of a movement disorder is basically loss of voluntary control of our body. So a lot of people will think of things like Parkinson's disease, stuff like that, where people start to lose their motor control. What ultimately happened to me and happens to lots of people around the world is that you can have a movement disorder develop as a side effect of medication. And the biggest culprits tend to be some of the mental health medication. This isn't something that oftentimes gets talked about a lot. And while it can be temporary for some, as is the case with me and my story and my book, it ultimately ended up becoming a very chronic condition, because it was a side effect of this pill. And I should say that all of the medications do list this as a side effect. It's just something that gets kind of brushed under the table a little bit. So I was hoping to introduce people to that concept and just kind of dive into there a little bit. With regards to my story, I guess, and my book, so my book is a memoir, and it basically kind of documents my own struggle with anxiety and depression that I was going through about I'd say about a decade or a little bit longer at this point. Originally, I wanted to talk to somebody and I wanted to go through talk therapy, but I don't know how it works in all places across the world. I do know that here in the US, oftentimes if you see a psychiatrist, their big role is really in prescribing medications. I didn't know all the ins and outs of therapy at the time, and I went to see a psychiatrist who kept kind of pushing the medication route of things. And I tried this, and it was really through this trial of medication because I don't think anybody gets to take just one pill. You usually have to try a couple of these different things. What ultimately ended up happening is it started to escalate to the point where now, at some point, because these other pills weren't working, which should have been a warning sign for me, because these other pills weren't working, I kept getting put on stronger medications. And ultimately, some pills that ultimately created a movement disorder. Now, I should say probably about a decade ago, people didn't really even understand what this was or didn't understand much about it. It's not like we didn't know it existed, and it's been in the literature for decades. We've known about this since like the 1950s and since the development of medications for the mental health medications. But doctors weren't used to seeing it very often. We used to think this was something that people would get if they had been on like long-term antipsychotics. And we're now starting to see people who were getting them from being on them a very short amount of time. And that's the other thing I guess I should point out as well. Biggest culprits for these medication-induced movement disorders are antipsychotics. Now, a lot of people will think, well, that's not something I'm going to go on. That's not something I'm going to take. But a lot of times, at least here in the US, these things get advertised on TV as an aid for your depression, as an aid for your anxiety. I don't think the general public is always informed about the type of pills they're taking because now we also have medications for tardive dyskinesia. And that's partially what I have is tardive dyskinesia, which is one of the movement disorders, and akathisia. So we're starting to see commercials to treat the medication-induced movement disorders that have happened because of these pills. So this is clearly affecting a lot of people. And it was just something I wanted to kind of bring attention to. It's a very harrowing journey to go through.
Oh, thank you for sharing that. And as I'm listening to you, there's all sorts of alarm bells going off because I know quite a lot of people who are on medication for various different mental health challenges they're facing or mental health struggles they're facing. So I'm just kind of wondering if a lot of the things that they think were just things that were happening to them in their lives at the time actually may have been related to the medications, but nobody connected the dots. It's very interesting that you mentioned that. And also that there's now medications that treat the problem with the medications, because that should give us some insight into actually how common this might be, even if we don't think it is. So
Yeah.
that's actually quite scary to see that that is happening now. The interesting thing is that I was on medication as well as Zoloft and all sorts of different things when I was struggling with my mental health. And I don't know if I would have connected the dots or if I would have just thought that I was experiencing some sort of problem just generally in my life. And I would have maybe not even known that was from the medication. So were you aware that the problems that you were experiencing were coming from the medication, or was this something that took a lot of time to actually connect that together?
So this took quite a bit of time, and this is really the journey of my book, ultimately. Unstill is the title of the book, which I thought was very fitting for a book that really this inability to sit still, which I think is very hard for people to comprehend. But originally, and see, this is unfortunately some of the problems with this, is I could certainly tell that these medicines weren't working because it was usually some sort of side effect that was created or that developed. And the really big one that did me in is when I tried an antipsychotic, which originally at the time they said, we're going to put you on a very low dose antipsychotic. It's basically just like small dose for depression, anxiety. I didn't realize that these things are heavy duty pills. So when I was ready to get off of the medication and I said, I think I've had enough of this. I'm going to stick with talk therapy. I think my life's going okay. I think I'm going to kind of push this to the side. I had found other tools to be able to sort of manage my life. That's when stuff really kind of like hit, because when you stop some of the medications, The thing with movement disorders, when you start, stop, increase a dose of the medication, that's when a lot of these disorders make themselves known. Now you've got people who are getting off the medication and all of a sudden they're starting to develop movement disorders. That's very much what happened to me. I was about 2 weeks off of the medication, and that's when I started to have all these movements, and all of this stuff never was there prior. And as people read about in my book, trying to get answers on this, because what ultimately ended up happening is doctors didn't really even connect it. They didn't like, oh, well, this must mean you need more medication. It kind of got to this sort of place where I was getting even more medicated. There was a trip to a mental health facility because they thought I was experiencing other sorts of mental health issues. It just became this big thing that continued to get blown up. And it wasn't until I was able to find a really good doctor who understood this stuff, he was able to sort of say, like, this is what's going on. This is actually because of the medication. It really took quite a journey. And I think the book still is really about this journey of trying to find answers when you have none, and having to go to doctors and feel like you're making something up. Because at the time I was like, clearly I'm having movements and things like that. But to have doctors who just really weren't aware of this, as I will say, it's gotten a little bit better today as people are becoming more educated on this. But that's really my, I think, job now, is to start educating people on this stuff. I've used this as an opportunity to start educating either my patients or other people about, listen, this is not candy you're taking. This can cause some really serious stuff. And it took, I think, way longer than it needed to take to get an answer on things. And so much of this, unfortunately, because we don't know who's going to get this. Some people will take a medication, they'll be absolutely fine. Some people will develop something like this. And because we don't know who is going to develop this, the best thing we have for medication-induced movement disorders is prevention, making sure the public is informed, making sure people are informed about this so that they can weigh out the consequences versus what they're feeling, because it has really destroyed people's lives. People have taken their lives from having this. So to just give a little idea of how serious these things can get.
Yeah, thank you for that. And thank you for explaining that in a little bit more depth so that our listeners can start to understand, to make informed decisions, like you said, about whether they'd like to take medication or go to a therapy route instead. So when you talk about this movement disorder that started happening, what can our listeners imagine that to be like? So are these sort of involuntary movements that start happening, or do you get sort of like frozen where you can't move, or what can they imagine this to be like in their lives if this were to happen?
Sure. So medication-induced movement disorders, it's a broad term for all different types of movements that can happen because of a medication. I'll share the experiences that I've had with mine. There's two big ones that I think people are becoming more aware of. The first being tardive dyskinesia, and the other one is akathisia. Tardive dyskinesia usually comes with a chewing sort of motion in the mouth. So people might notice themselves just chewing, or like their fingers are playing the piano. They won't be able to stop. That's one of the more common ones. There is a Parkinsonian tremor, and the tremor is basically what we think of when people are just shaking. That's another common one that people get. To me, the most torturous one is akathisia, which is what I experienced in its full form, and to some degree still do to this day. This is literally the inability to sit still. So what happens is you have this internal sort of agitation inside of you. So it's almost like a volcano is building up inside of you. And all you want to do is sit down. All you want to do is sleep. You can't. And it's like you've literally drank 50 cups of coffee and you want to rip your skin off. You just cannot silence any part of your body. And you can try, but it comes back. Additionally, there are tics and things like that that will develop as well because of this. Just to give you an idea for other people who've experienced this, because people think, okay, well, you can't control your body. I mean, this can get to the level of going on for decades for people where they just cannot sit still. They're not getting proper sleep. They're not getting proper nutrients. People have literally compared this to like wanting to rip your skin off, which I can certainly attest to. In the early phases of this, when it's most acute for most people, it's like this agitation that will never go away. You can't sleep. All you want to do is pace and walk all day. It's like your body won't let you stop moving. So you're constantly on this merry-go-round of just walking and pacing and pacing and pacing. So those are the biggest common ones. There are conditions like dystonic reactions, which is where a muscle will lock up. So all these different types of movements can develop as a result of medication. But the biggest ones to look out for, I would say, for anyone who's listening, if you're starting to feel anxious on one of your pills that's supposed to decrease your anxiety, it's probably not a good idea to continue with that. And that's usually a lot of the early warning signs that I've heard from at least a lot of people I've talked to, is they generally had some sort of internal agitation, anxiety, that something just didn't feel right. And that's when it's time to say, okay, we don't need to go any further with this.
That's very interesting, and probably a very good thing to listen to our bodies at that time and really listen into what's happening.
Absolutely. I will say that a lot of my book and is really about a journey of learning to trust yourself. I think there was plenty of points throughout the process where I should have and probably needed to listen to my body. And then when I actually did start listening to my body and saying, okay, this is not right, that's when I was able to start to really push myself to get answers, push myself to find doctors who understood this, and ultimately find people who were able to sort of help me through this and guide me through this. Because when you're dealing with something that a lot of doctors are not familiar with, although I will say again, today is better, it can paralyze you. And so many people, I've worked with people or I've talked with people who've unfortunately taken their lives from these things as well, because it really is torturous and they feel as though they can't stop the movements. And when your body just won't give you a break, it can be very invasive on your life. You're not able to work. You're not able to do the things you wanted to do. And it's really a waiting game. That's the hardest part, I think, to tell people, is that so much of the treatment for these things right now is slowly removing the medication and slowly letting your brain sort of heal itself is really the best we have right now. There are other medications that will help treat this, but a lot of people respond very differently to those even. That's why I'm very much this idea of a patient advocate and being able to say, okay, can we try other methods first before we run to the big pills?
Yeah, absolutely. And valuable information for listeners to know and to share with their loved ones as well, and people they may know that are trying to make these decisions now. When you're talking, I'm getting the sense that this is not healed. You're still experiencing some of the challenges that you were, maybe not as much now, but is this something that when you come off the medication, eventually this will heal? Or is this something that might sort of stick around and there's not really a cure in that sense for it? Or what has been your experience with that?
This is going to vary for everybody, I will say. And again, some people will experience medication-induced movement disorders that will, generally speaking, sometimes they just last like 6 weeks. And then people are kind of, their bodies regulate back to normal. It really depends on how long you were on the meds and what kind of meds you were on. For myself personally, I am one of the people who has chronic, officially the diagnosis for me is chronic akathisia and tardive dyskinesia, which basically implies that it will be a long-term thing. And they gave me a more overarching blanket term of tardive syndrome, which just means my movements don't fit into one specific category. So at its early phase, when this was first happening to me, this was like a 24/7 thing, like nonstop. I mean, for months and months on end. In my case, I was able to get off of the offending medication. I was able to get off of a lot of the stuff. We had to add a few other medications in there to kind of try and balance things out as best as possible just to get me to function. But it will go through a period of waxing and waning. So generally speaking, if you saw me today, you probably wouldn't even know that I have this, but it kind of goes up and down. So it's kind of one of those things where it has certainly gotten better with time. And that's the one thing I always tell people is time is your best friend with this disorder, because the brain just needs time to heal itself. The trouble is that for most people, it's the removing the medication. You can't just quickly get off of a lot of these pills, as is the case for me. So I am still on some medication to this day that we're slowly working to remove from my body to get this thing under control as best as humanly possible. But it has to be at like a snail's pace, and everybody's body is going to be different for this. So trying to just remove the medications becomes a process in itself. So I would generally say today I'm able to manage a lot better than I was. I still have my days. There are still days that make it very difficult, but overall, I'm in a lot better space to be able to write this book, to be able to pursue my art, help my patients, and to be able to go through with my life. But it will be a journey that will ultimately probably take me, and I don't know if I'll ever be able to fully get off the medications. I'd like to hope and think that I will, but it's a slow process of just, okay, we're going to have to just step by step by step with this. That's why I'm very big on this idea of prevention. The more we can prevent, save a lot of people from these types of things.
Yeah, that makes a lot of sense when you say that. Do we know, Lenny, what happens to people when they're affected by these medications? Does this actually physically change something in the brain long term, or is there any information available as to what happens to us if these movement disorders start?
Sure. I'll give you like the nuts and bolts of this because this can get into very heavy neurology. But in general, here's the working theory behind tardive dyskinesia. Antipsychotic pills are dopamine blocking pills. So when you put a dopamine blocking pill into the brain, for some people, what happens, we believe, with tardive dyskinesia and some of the other ones, that your brain starts to develop extra receptors. And when you remove the medication from the body, those receptors, now you've got all these extra receptors in your brain that don't know what to do. It just so happens that a lot of the areas that we're trying to adjust with medication happen to be the place in our brain where voluntary movement is controlled. You're starting to mess around in that area, and that's where these extra receptors start to get developed. In theory, as time goes by, those receptors will just naturally die down. But that's anybody's guess for how long it is for some people. It certainly gets much more complicated than that. Dopamine plays a very big part in this and the role of the balance of dopamine in the brain. There are physical changes that do happen in the body. Unfortunately, some of this stuff is such at a very microscopic level that like a traditional MRI wouldn't pick this stuff up. You wouldn't be able to see this on a traditional brain scan. For example, the way you'd be able to see Parkinson's, you'd be able to see that there's parts of the brain that are fading or there's parts of the brain that are not functioning appropriately. With this, it's very much like at a microscopic level. Again, it just makes it harder to a lot of this stuff goes basically off of patient reporting.
Yeah, and that leads probably to those very long journeys that you were describing to try and get help or some sort of answer or resolution to what is happening, because it is very difficult, it sounds like, to detect even in some sort of lab test, if you will, to definitively say, okay, this is what's happening. So, yeah. Let's talk a little bit about what people can do to find help, because this seems to be the other part to what you're describing, and what you're describing in your journey is this starts happening, but then there is sort of a lack of help that you can get, a lack of advice, a lack of resolution where you can actually find out what is happening and get some help. So if there's people listening who might suspect that this is happening to them, or they may already be experiencing that, what would you recommend? Where do they start looking for answers, or how can they start this journey of finding some help for this?
Sure, sure. Well, there are some great organizations out there that have popped up with regards to this stuff. First and foremost, I'll say that you should be working with a psychiatrist if you are on medications. A lot of people will get these things prescribed by their general doctors or people of that nature. You want to find a psychiatrist that will answer your questions, that understands this kind of stuff, and that will be able to work with you through this. So if you're going to go the medication route, please, please, please find a psychiatrist that you trust and that you can work with, and that will answer all of your questions about side effects and things of that nature. But for those who are already in the midst of struggling, generally speaking, It will be through other psychiatrists. So making sure you have a psychiatrist who's knowledgeable about this stuff. There's movement specialist, which is where I found my answers, basically neurologist at the end of the day. And a lot of movement specialist programs are now starting to see an influx of people who are coming with all these sorts of disorders. Neurologists who are movement specialists, not your average neurologist, they might not be able to pick this up. Your average psychiatrist might not be able to pick this up. There are great organizations, too, that I can think of off the top of my head. The Akathisia Alliance, which is wonderful. They provide a lot of the information and research. There are coalitions like the Benzodiazepine Information Coalition. They're another organization that will help people, at least point people in a direction of things in doctors that might be available. It's so hard to find doctors who work with this thing. And I know that's one of the biggest challenges for people, because when you're talking about all the different places in the world, who has knowledge of this versus who doesn't, it's still a hard thing. Not everybody's aware of this 100%, or they know about it. It's just not something they're used to seeing. I would say that, but I will tell you that as crazy as this sounds, Facebook has been tremendous support for a lot of people, because if you type in akathisia, tardive dyskinesia, there are so many groups that will pop up now, and a lot of information gets passed this way. Now, I should say that a lot of misinformation gets passed this way, but oftentimes a lot of some of the research and stuff that I was finding was coming through like Facebook research, and oh, here's the studies, here's the data. There's a lot more information now than there ever was, but the real trick is making sure you have a doctor who will work with you and not being afraid to be that patient who says, okay, you're not helping me. I need to find someone or get a second opinion so that you can work with somebody who will help you work through this process. Those are my big things. Always, always, always make sure you're not doing this alone, even though it may take you several rounds of people to find somebody. It took me about a dozen doctors before I finally found the one who said, oh, yes, this is what's going on. Don't give up in that fight. Be willing to try other people. Not everybody's going to listen. Not everybody's going to want to hear it. Not everybody's going to come to the same conclusion, but it's finding that person who's appropriate for you.
Yeah, that's really good advice. I think for healing journeys in general is having the support, the community, somewhere where you can lean in, because it does get sometimes very tough. And as you mentioned, it can be a huge mental, physical, and emotional challenge to embark on these healing journeys. So, yeah, thank you for pointing that out. And of course, our listeners can also get your book, and we'll make sure we link to that in the show notes. They can read your story as well. And you're a therapist, so you work with patients and clients. Do you have any programs or services available where our listeners could connect with you if they wanted to work with you as well?
People can visit. I've got two different websites. I keep my writing and my art separate from my therapy practice. I do occasional consultations for people who think they're struggling with movement disorders to kind of help point them in the right direction. People can visit Lenny Gallo, lcsw.com, and they can read more about my services and the things that I do there. Anyone looking for the book, I'm going to direct you to lennygallo.com, and that's where all of my art and writing is. So if people want a copy of the book, also available on Amazon, all the usual places that people buy and listen to books. It was very important for me to do an audio version of Unstill, because people struggling with a movement disorder may not be able to sit and read a book. So I wanted to make sure that there was an audio version accessible as well.
Wonderful. And we, of course, will be linking to all of Lenny's offerings in the show notes as well. So be sure to check there for where you can find his book, his website, if you want to connect with him. And if you're suspecting that you are developing movement disorder because you have been on some medications that may cause this, maybe reach out and speak with Lenny, make an appointment or a consultation so that you can start those steps for your own healing journey and find a way to advocate for your own health. As Lenny said, you may have to ask a few more people on this journey, but eventually, hopefully, you will find some answers for yourself as well. I just want to thank you, Lenny, for being here today and sharing your story with us and advocating for this sort of preventative approach so that we don't have to talk about this as much in the future because people are more aware of it, which would be wonderful. Because as you said, the impact of this is life-changing for people, and prevention would certainly be the most preferable approach to all of this, I would think. So thank you for sharing all of that and the courage to speak up about this and share this with our listeners. I truly thank you for being here today.
Thank you so much for having me. I'm really glad to be able to share my story with people. And if I can help just one person, that's kind of why I wrote this book.
Yeah, absolutely. And we'll make sure that we connect our listeners to the book as well so they can read your story and your words in that book. So be sure to check the show notes. We'll put everything there for you. And Lenny, again, thank you for being here today and take care.
Take care. My pleasure.
Thank you so much for taking time out of your day to listen in. If you enjoy the Jōrni Podcast, please support us by subscribing, sharing on social media, and leaving us a review. We appreciate you. And you can find more of The Jōrni on Facebook, Instagram, TikTok, and our website, thejorni.com. Sending you love and courage, and see you next time.